Using WebMD, we discovered that a surgical oncologist's job entails providing care for patients by diagnosing cancer with a biopsy or treating cancer by removing tumors or cancerous tissue. It is important that they can identify the difference between malignant and benign tumors in order to provide the best possible treatment. In addition, surgical oncologists are responsible for making sure that the patient understands the meaning and extremity of their condition. They are to explain to the patients possible courses of treatment and the best treatment plan. They also conduct patient pre-op therapies specific to their condition using multimodality treatments. Multimodality therapy uses more than one method of cancer treatment, for example, surgery, chemotherapy, and radiation. Because this job has many responsibilities, using salary.com, we discovered that the very large average salary of a surgical oncologist is $237,507 a year.
During research, we found an article outlining the educational requirements for surgical oncology. Study.com outlines a step-by-step process for educational requirements to become a surgical oncologist. One must first earn a bachelor's degree, then an additional 4 years to complete medical school, which includes 2 years of foundational practices of medicine, bodily systems, and diseases, and 2 years of rotating through different hospital specialty departments to learn about patient care and gain experience under faculty supervision. Students must also complete examinations during their last year of medical school, which may include the U.S. Medical Licensing Examination. After medical school, students must complete their residency in general surgery, which includes conducting physical exams, taking patient histories, attending conferences, and interpreting lab information.
The last step is to complete a fellowship in surgical oncology, which helps students gain experience by practicing surgery on different types of cancer. After completing these requirements, the students are permitted to practice medicine as a surgical oncologist. According to the NIH, we found the increase in malignancies internationally has created an increased desire to cure cancer.
Scientists have been developing and researching new medical techniques to discover a cure or an advanced form of treatment, like the Da Vinci C robot, at a rapidly increasing rate. In the early 20th century, doctors were performing surgeries that reached the maximum tolerability levels of patients, which resulted in a decrease in quality of life throughout the post-operation stage. Surgical oncology relates to the healthcare system, as the career has become increasingly prevalent in medicine in today's society. In the early 20th century, when the presence of malignancies was on the rise, the search for a cure became more common and over the years further advanced. As cancer is becoming increasingly noticed, the advancements and motivation for a cure have rapidly increased over the past century. Because of the abundance of cancer conditions that have been discovered, new occupations and advancements have been formed to increase the rate of discovering a cure. By doing so, new inventions such as the Da Vinci C robot have been created to perform minimally invasive procedures in oncology.
The world of medicine is constantly being improved, and with that, the world of surgical oncology advances with it. Researching this job taught us more about the advancements that can be done in order to save more lives. For instance, Langone Health of New York University has furthered our knowledge of the Da Vinci C robot and its roles in becoming a new advancement. The robot is designed to shorten the time of surgery, allowing the patient to undergo anesthesia for a shorter amount of time and reduces the risk of infection. The robot also lessens the chance of the surgeon making a mistake during the surgery by simplifying complex movements. We were inspired to learn more about surgical oncology because my mother works as a chemotherapy nurse, which brought our attention to the importance of surgical oncology. Because of the significance her career has in society, I personally am interested in possibly becoming a surgical oncologist in the future. My knowledge for surgical oncology has also been motivated by the death of my aunt from breast cancer, as well as my grandma's multiple biopsies and squamous cell removal.
In conclusion, from informing patients of their condition to performing procedures that could save lives, surgical oncologists have become a very important role in our healthcare systems worldwide.